Good evening, everyone. If you live in this region in South Georgia, your access to Level 1 trauma care and neonatal services are in jeopardy. Memorial Health is one of 5 hospitals in the state and the only one in our region with the highest accreditation level for critical care.
Over the years, Memorial has been losing money as the healthcare industry continues to evolve. In a WTOC investigation, Elizabeth Rollins found those other trauma centers are better off financially because they receive millions from their local municipalities. Meanwhile, Chatham County has not given Memorial Health any money in more than 20 years.
And Elizabeth Rollins is joining us now live. Elizabeth, you uncovered Chatham County has actually been giving millions of dollars to other health organizations?
They sure are. Meanwhile, the hospital authority continues to desperately try to find a new partnership after Novant Health backed out of that multi-million-dollar deal last year. So if the hospital doesn't find a new partnership and if they continue to be in the situation they're in, 35 county region, everyone in that area will be impacted.
What is this? Oh. Watermelon. Yeah.
It's double the trouble in this Brunswick household. Ashley Brooks is the mom of fraternal twins who recently celebrated their 2nd birthday. She says it's hard to believe it's been 2 years since they were in the neonatal intensive care unit in Savannah.
We went to the hospital thinking that I was going into labor. Lo and behold, I was at 32 weeks, and so they immediately put me in an ambulance and sent me to Memorial because they have the highest level of care that was needed at that time.
Brooks knew carrying twins came with the risk of delivering early. In fact, it's the only option for folks south of Macon and Augusta. But Memorial's NICU services and Level 1 Trauma Center are now threatened by rising healthcare costs, indigent care, and less revenue. The hospital was depending on a financial partnership with Novant Health last year, but they pulled out of the multi-million-dollar deal, blaming the Chatham County Hospital Authority for overstepping their boundaries. Tensions between Memorial Health's board and the hospital authority have only continued to grow since then. Sources tell me right now the hospital has 3 financial options. They can either change their mission as a nonprofit, find a financial partner, or get money from Chatham County. But y'all are right now trying to find a partnership basically to save the hospital. I mean, so this would be an option to go to the county and say, y'all could be chipping in here to help us out with some of the.
Well, I don't want to. It's really a mischaracterization to say that. Chatham County has done a number of things financially and otherwise to support the hospital.
But all 159 counties in Georgia rely on these 5 Level 1 trauma centers to handle the worst of the worst cases, in addition to providing indigent care for those who don't have insurance. Most of these hospitals receive funding from their local county government. Grady Memorial Hospital in Atlanta receives more than $80 million a year. In 2016, Fulton County gave them more than $60 million, and DeKalb County gave them $20 million. But Memorial Health hasn't received a dime in more than 20 years from Chatham County. What's the reason why the county has never given Memorial a dime? I mean, you've got Grady, Fulton County gives them $80 million.
Are you new to town?
No, I'm not new to town.
Well, you need to reflect on this. When the county took on or refinancing a memorial debt, now this is before I became chair, it was supposed to free up $26 million in reserve that they had to hold in reserve to satisfy the obligations of the previous bondholders. So think about this. They freed up $26 million. They had specific things they were supposed to do with that $26 million. I don't think they've all been done, and I won't get into the details.
But WTOC sources tell us that one-time lump sum was used for their expansion projects, hardly comparable to funding that's awarded year after year. In the meantime, commissioners have awarded almost $18 million to the Curtis V. Cooper Health Clinic and the Chatham County Health Department in the last 4 years. That's according to budget records. Commissioners also had no problem spending $300,000 tax dollars to audit Memorial Health for a second time this year.
They had an external audit, which is required for financial reasons. We were looking for something more than that, and hopefully we'll get something more than that. Not only were we looking at the hospital, we were looking at the operating board, but we were also looking at the hospital authority board in that audit, and then we were also looking for recommendations as to how we could make that facility profitable.
Some commissioners calling it a forensic audit, which means it could be used in a lawsuit.
Was the purpose of this audit to be used as leverage as a potential lawsuit later?
No, and I don't know where such a question would come from. No one's ever mentioned a lawsuit. I don't even know what you're talking about.
Well, that was brought up in the county commission meeting back when this was originally passed.
I'm a volunteer, and I don't attend the Chatham County Commission meetings, and they don't report to me. So I'm not aware of what you're talking about.
But just days after Waters announced at a hospital authority meeting that auditors were wrapping up, Memorial Health CEO Maggie Gill announced she was stepping down.
So y'all weren't looking for reasons to push Maggie out?
We don't control that. Ms. Gill works for the operating board, not the hospital authority. She doesn't work for the county commission. So we have no means in which of pushing her out.
The actual findings of that report still haven't been released, but for folks in the area, it really doesn't matter. What does matter?
What does that sheep say?
Family. Mothers like Ashley Brooks is worried about the safety and security of her family.
We travel 95 and 16 frequently. Seems like every weekend now, but and the fact that if something terrible were to happen and we don't have Memorial to go to, and there's not an immediate level 1 trauma center to go to, it's frightening.
And she says it's frightening to think local tax dollars are not protecting anyone in this 35-county region.
I think that's the #1 way to support something, and I think when the community sees that you're supporting something with your money, that's something more you can rally behind.
Now, the former CFO of Memorial posted in the newspaper last week blaming all of this on local politics, saying that as long as the hospital authority is as involved as they are, the hospital will continue to flounder. We asked Al Scott about these accusations. He denies any of this has to do with local politics and the issues surrounding both boards. Of course, we'll continue to follow this story and keep you updated. We're live from Memorial Health. Elizabeth Rollins, WTOC News.
And in that continuing coverage, we'll continue Memorial Health as it searches for a new CEO. And you can go right here to WTOC.com Investigates page for updates.